Can you actually talk a little bit about what's our journey with MAID so far at UHN?
It's been a real journey of learning for us about building the right kinds of structures.
From your perspective and from the various folks that you've spoken to, what are some of our ongoing issues or concerns or challenges?
The challenge has been thinking hard about people who might not be comfortable, initiating the conversation. MAID is like one of those hard cases we run into all the time when a patient might say, I don't want a tube feed. I don't want dialysis anymore. I don't want chemotherapy. And the team has to face the fact that people who we think have lots to live for have decided to stop treatment. And it causes huge moral distress, big conversations. So we knew that it was already hard to say goodbye to some of our patients, to honor their wishes, but the biggest challenge is how to talk about living and dying well and according to your own values.
I do believe we actually have a good process in place. It's not just me saying that I'm ready for it and it's going to happen tomorrow. We do have the proper channel and we do have an assessment team based on the people who volunteer to do the assessment process.
The fact that UHN decided quite deliberately to say we want to hear from volunteers who want to be part of this helped us a lot with talking about MAID. So people didn't feel like they were going to be conscripted to do MAID. And the folks in psychosocial oncology, Madeline Lee, Gary Roden, helped come up with a framework. And it sets out the conditions or a criteria that have to be met. There's a waiting period. There's a requirement for capacity. But we also have a distinct assessment team and intervention team. And they're both separate from the clinical team that cares for the patient. And we also have a MAID review committee that's going to look at the quality and help us to learn from every single case.
It is my understanding that not infrequently the assessment may actually, and maybe even better discussion with the patient, may actually lead to a no MAID decision. But I think it was still very worthwhile for the patient because as a result of going through that process, some alternate treatment strategy were deployed to the extent that they were able to probably live a better quality of life for their remaining days.
A request for MAID should initiate a conversation about why you think you need MAID.
Exactly.
We would never want patients asking for MAID to think they had to ask for it because they couldn't get good quality palliative care.
Now, it's fair to say that not all of the healthcare professionals are comfortable even talking about it. And secondly, some would be shocked that how could we even end someone's life that way? But I think on the other hand, I think we have an obligation to know that it is the patient's wish, it is their lives, and they can make a conscious choice. We should respect them, and if one personally is not capable or willing or interested in doing this, then we should then make the effective referral to make sure the patient has the chance to actually go through the process to see whether this is the right option for them.
I hear what you're saying, Charlie, and it has been a hard conversation for some of our providers. But it's an opportunity for all of us to think about that kind of advanced care planning conversation that I think patients tell us that they want their care team to initiate those conversations. Let them open that up to us if they feel they need to, and to know they're safe asking for what they need. Because the worst thing in the world that could happen is that a patient asks the question and feels shut down, or that's a forbidden conversation.
You're not here to promote MAID,
No.
but we are here to educate, I think probably more importantly, our staff and then indirectly to the patient to say, it's okay to ask about it. Because I totally agree with you. I think there is still a significant notion out there amongst a lot of patients who are near the end of their lives that raising the concept of MAID was not going to be that well received. And I think we need to gradually move in a direction whereby this will be an acceptable open discussion. The more that we can make that to become something that this is an okay question to ask, and it is one of the treatment options that can be explored, I think we would actually empower patients and put them in probably a safer space.